Hi there, I'm Dr. Matthew Terzella from Piedmont Physical Medicine and Rehabilitation in Greenville, South Carolina. And today I'm going to talk about laser-assisted liposuction and fat transfer for structural support. Here at this office, we use the FDA-approved Beautifil system to accomplish this. It's a really great system. It allows us to harvest the fat in such a way that it's very gentle and it's still very viable. The Beautifil people tout that the fat lasts for 3 to 5 years and is viable for that amount of time. Now, this system is originally designed to help fill in some of the facial features as we have fat loss in our face or in different areas of the body. We here at Piedmont Physical Medicine and Rehabilitation use it from a regenerative standpoint to help people who have joint pain, muscle aches, tendon pain, all these types of things that we could potentially use it for. So it's a really elegant way of doing things to use your own body's fat with minimal manipulation to allow it to have some of the regenerative capacity that we know fat has. We put it to work for you. At the same time, we do take into account how you want it to make it look. If you want to get some fat from here or from anywhere else, within the confines of what we feel comfortable doing, we will do that. So the idea is to help maybe you feel good and look good at the same time. Now, looking good is always optional, but most people tend to go for that piece as well. So it's a fairly simple procedure. You come in, we do a consultation with you, we take a look and see if you're in fact a candidate. Sometimes people are not candidates, but a lot of time they are. There may be other potential treatments we can use in lieu of it, but if we feel you're a candidate, we will express that and we'll tell you about the plan moving forward. Generally it involves you come in, it's for in-office procedure. We have a suite set up. You lie down, we mark the areas we need to get to, we numb up the areas, and we harvest the fat. Once we have the fat harvested, we minimally manipulate it, if at all, and then we put it in the areas that need to be treated. Then after that, we put some platelet-rich plasma in after that to really direct the regenerative capacity of the fat and all the things that entails. Now, people may ask, they ask a lot, do I have to be put out for this? The answer is no. There is no general anesthesia here. Everything is done locally. Does it hurt? Quite frankly, the folks we've done this on, there really is very minimal to no pain during this procedure. You may be sore, you may have some bruising afterwards, right after the procedure over the next few days, but that will go away fairly quickly. Will you feel sore in the areas we treat? Yes, you will, and that's a good thing. That means your body is working to help heal and help recover and heal the damaged tissue that brought you here in the first place. So that's how that kind of works. Other potential questions that folks will ask is, how long do I have to wear a garment? Well, we have you wear a garment at the area that the fat was obtained to help compress it and help it heal, and so it looks much better. The answer to that is as long as you want to wear it, whatever you feel comfortable with. If you have a large area, we recommend anywhere from 2 to 3 months, because the longer you wear it, the better aesthetic result you get. If you have a little pocket, an area that you really don't care about, you can wear it a couple of weeks, just as long as it heals and cinches down. Another question I get is, are any stitches involved? Well, truthfully, the openings are about this big. Sometimes 2, sometimes 4, depending on the amount of area we have to cover and depending on the size of the individual. And those things will heal on their own. There are no sutures, no steri-strips, no nothing. That will heal on its own, and we want that area to drain. So that is really it in a very tight nutshell. It is very well tolerated, and people do well right afterwards. One other thing, I get this question a lot, so what's the recovery time? Well, the first day we ask you to take it easy. Second day you get up and walk around, do what you need to do. At 2 weeks, I will see you in follow-up and make recommendations as to what we should do next. A lot of times I will have physical therapy or order physical therapy to help you maximize the areas around the area we're trying to heal. Like for instance, if it's a knee or a hip or a shoulder. Physical therapy is very important because that you're using the muscles and the tissues around it, and that maximizes your overall level of function. So the combination of the two really does wonders for many of the patients. Now, the other question I get is, who does this treatment work for? Well, the answer to that is pretty much most people. Anyone who's got ligament tendon injuries, shoulder injuries, knee injuries, or knee osteoarthritis, hip osteoarthritis, shoulder arthritis, or anyone who wants to potentially avoid surgery or more, how should I say, it's more invasive type of procedures. Now, is it for everyone? Not necessarily. Sometimes you just got to get the surgery done. That's just the way it is. Is there a guarantee? No, there's no guarantees in anything in medicine. I've been around long enough now, sadly, to know this. So there's really no guarantee. However, it is a great option for those who want to avoid surgery or just can't have surgery. We have several patients who, for one reason or another, can't undergo general anesthesia, and they just don't want to do the rehabilitation that a major surgery entails. This is a nice way of gaining function, relieving pain, while avoiding that type of scenario. So those are the patients that we look at most. We have everyone from weekend warriors to high-level athletes who do this. We have even people who just want to look better, and they just have a little aching knee. They can't get that and do that? Yeah, sure. So that's how this works. I get asked if people have chronic pain, would this work? Yes, it can work for people with chronic pain. However, we have to have some targets in mind to target. Like if the shoulder and your knee are your biggest targets, well, yes, we can definitely address that. If it's widespread whole body pain, it's impossible to just target everywhere on your body. However, if there are a couple of foci of pain, if you will, yeah, we can definitely address that and hopefully take your body's total load down to where you could live a much more livable life. So one of the benefits of using your own fat, for years people have been getting fat and getting regenerative capacity out of it by processing, taking out what they need from it. You may have heard of adipose-derived stem cell. Well, right now we use the fat. We don't extract any stem cell from it, but we do believe that there are some medicinal qualities to the fat, and that's one advantage. Another advantage is that most people have plenty of fat in abundance, so we know there's a good supply, so that we can do this appropriately and have enough supply to address all the different areas. A third advantage is it's your own stuff. It's your own stuff. There's no rejection here. It's your own tissue, so there's no worry about, am I going to have an allergic reaction? Am I going to reject it? There's none of that. So those are major advantages to the fat. And like I said, this particular system allows us to harvest it in a very unique and gentle way so as to maintain the viability of the live fat cells, and I think that's a really important piece of this. So if you're interested, please feel free to give our team a call at Piedmont Physical Medicine and Rehabilitation. The number is listed here, but for those of you who don't have access to it, it's 864-235-1834. We'll be happy to talk to you and give you all the information you need. And hope to see you here, and hopefully we can get you on the road to recovery. Thanks.